both above and below her scar. We did that in surgery, and then we gradually inflated these balloons to essentially stretch out her skin to recruit more area of tissue that we could move into the scarred area.
I'm feeling better and I'm more active, and this year I was in athletics and I could do more running, and I was confident with showing my skin, and it was easier for me to be active and play around and have fun like I wanted to. It's just so much better.
Before I went to see Dr. Swanson, I had just had a baby. I was 26 and found out that I had gout. Woke up one day and couldn't walk. My feet hurt horribly, and went to my doctor, and she ran some tests, and it came back that that's what the problem was. And she told me that basically the easiest way to get rid of it was to lose weight.
Megan Zarella, she's a relatively young girl who significantly overweight. She was in her 20s, and she didn't have diabetes or high blood pressure, but she knew that she was in trouble because of her weight. She did have gout, and that causes joint pains and flares up when you eat certain things. And we know that, that doing weight loss surgery can help that. So she was real interested in not only being able to be more physically active, but also in helping out with those joint problems that she had.
Well, I was 250 pounds, so when I went to see Dr. Swanson, he said that I was actually a really good candidate for the weight loss surgery, and we talked about which procedure I'd want and discussed what insurance would cover, and decided that the gastric bypass procedure was the best thing for me to do.
So she had a gastric bypass, and she's just done really well with that. She's still relatively early in the game and is continuing to lose weight, but she's done very well.
Since the surgery, especially now that I've lost so much weight, energy levels are through the roof. As far as my gout goes, I have been symptom-free since surgery. I haven't had any issues at all. I came off all the medications I was taking. The overall experience with this has been very positive. It's not easy. It takes a huge commitment to stick to it. When I see the results I have, I wouldn't change it. I wouldn't go back and do anything different than I have.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
I got up in the morning, and all of a sudden, as I stood up, I thought, something ain't right, you know? And so I guess pretty quick, I had a horrible pain in my back. I kind of, you know, messed around thinking that I would get over it, you know, that it would go away, and it just got worse.
A back fracture is a very important injury. It can be very debilitating to people, and especially in the osteoporotic crowd, the over 65 or around that age crowd, where they're already prone to having very soft bones anyway.
It just really took all the fun out of life, you know, because I was hurting so bad.
One of the things we can do now is we can actually go in and stabilize those fractures using cement. And it's a very well-known procedure that has had a lot of different modifications through time. Now we do it's called a balloon kyphoplasty. So we actually put a balloon into the bone and blow the balloon up to create a cavity where the cement will travel when we enter it into the bone, so which makes it a safer procedure to make sure the cement stays where it should go and doesn't go where it shouldn't go. When you do that, you're basically doing what a cast would on a fracture on an arm. You're immobilizing it. And what hurts from a compression fracture is movement. So whenever the little lady or little gentleman is rolling over in bed or getting up to stand, they're going to have extreme pain. And so they choose not to do those things. And they lie around. And when they lie around too long, things happen like blood clots in their legs form. And so there's a lot of things that happen when people are immobile. And so the goal of our practice is to get people active again.
The new procedure that he does is a wonderful thing. I would lie down on my stomach and then he would work on my back.
Even though it's a surgical procedure, they literally feel better when you're done with the procedure than they did when you start the procedure. I mean, we're talking about 60s, 70s, 80s, 90-year-old people that feel better and they get up and leave. They walk out and they're home and they're feeling better.
Dr. Stevens was just great with me. I feel wonderful now. I just feel wonderful.
Now to our next best doctor, and for those suffering from migraine headaches, this doctor can help. Dr. Ken Reed, for a number of years, has helped those suffering from migraine headaches.
I was experiencing chronic migraines 24/7, so 24 hours, 7 days a week. The only relief I was getting was sleep. So I would be willing to try anything. I would go to a neurologist. He tried every medicine in the book. Couldn't figure it out. He says, I met a doctor with the new procedure for stimulation for chronic migraines. Okay, let's go, let's see what happens.
The specific treatment we do here is an implanted neurostimulator for severe headaches. It's a unit that goes completely under the skin. It's somewhat akin to a pacemaker for the heart. There's a very small battery that's implanted under the skin, and from the battery, typically 4 very thin little plastic covered wires are passed up under the skin, 2 in the back of the head, and 2 of them end up right above the eyebrows. It's all under the skin. In fact, you can't see any scars or lumps. But once it's in, when it's turned on, they'll feel just a very mild tingling sensation in the front of the head and the back of the head. And by certain mechanisms, when they feel that, it very commonly either stops or dramatically improves their headaches.
After the stimulator was put in, I could see a dramatic change. I didn't have to take any medication. Except for a cold front coming in, I would just take a daily Advil Sinus or a Tylenol Sinus just to kickstart it. And then once I get my headache under control, the stimulator could take over. That's when I knew this was going to work.
Michael had these severe, basically daily, devastating headaches. Michael Parker kept on with life. He refereed the sporting events around here with the kids. So he was fighting through it, but it was still greatly limiting him. So it's been a couple of 3 years now to put it in. Michael has done great.
Whoever has migraines out there, take a look into this, because this can change your life, because it has changed mine. I would drop dead to save that man, because he saved my life.
What is advanced lipid testing? Most of my patients say, well, I had my cholesterol checked with my doctor. I say, well, advanced lipid testing is different. It evaluates different parts of the cholesterol, different areas that we can effectively make change. So it's important to do an advanced lipid analysis. There are multiple companies who provide that service. But ask your doctor to look at your lipids in a more advanced way, because there are things on the lipid analysis that can tell us if you have early diabetes, insulin resistance, if you have a high tendency towards clotting, if you're genetically prone towards having a heart attack or not. These are important questions that you need to know. When we're sitting out there in the communities and we have physicians that may or may not know about these things, I think it's important that there are informational shows like this out there that can teach you, the public, to check on your own health. So ask your doctor for advanced lipid therapy. It's an amazing way to take hold of your own health.
I had no energy. I was limp. I just barely could put one foot in front of the other. Every day was just a difficult day to get through. All I wanted to do was just to crawl into bed. I was so tired. I was also having some heart palpitations and flutters, and that was scary. I could tell something was wrong. So I went and saw Dr. Worrell.
Sleep apnea is really sleep apnea with hypopneas. There are two different parameters we look at when we're doing sleep studies as far as sleep disordered breathing. There's the pause in the breathing for 10 seconds, which constitutes an apneic episode. In a hypopnea, you don't breathe well enough to get proper ventilation and your oxygen level actually drops. So for people who every 2 minutes don't breathe well enough to ventilate their body, then we call that a severe sleep apnea. Severe sleep apnea is associated with various kinds of heart problems.
Dr. Worrell suspected that I probably had a form of sleep apnea, and he prescribed a sleep clinic, and it came back that I was borderline. So we waited for a little while more and did another one, and finally it came back that I was full-blown sleep apnea. And they, of course, said, you've got to have a machine.
A CPAP is kind of a necessary evil sometimes. Some people will adapt more easily than others, and for those who do adapt to it, they are the ones who are the most appreciative because they see the quality of life improvement. They wake up and they're not so achy, not so stiff in the morning, that they have more energy, more stamina, that they just feel better overall.
Within 2 weeks of getting a good night's sleep with a CPAP machine, I was back to 100%. I was like, it's a miracle. It's just absolutely a miracle. I think Dr. Worrell is probably the best doctor I have ever gone to. He partners with you for your health issues. He's not condescending. He listens and very, very gently pushes you in the right directions that you need to go for your health.
For more information on any of these outstanding doctors you see today on the show, head to the website. It's bestdocsnetwork.com. Right now, it's time to head to our next best doctor, right, Candace?
It certainly is. That's orthopedic spine surgeon, Dr. Robert Myles.
Low back pain occurs in about 90% of the population over their lifetime. Of those 90% of people that have back pain, about 70 or 80% of them will have a second episode of back pain. Back pain accounts for the second most common reason for missing work or school behind the common cold. Back pain can be just a simple sprain, and it can be something as bad as a disc herniation or severe degenerative changes in the lumbar spine. The majority of those back issues are related to some type of degeneration of the back in some way. In this model here, I have an example of what I would say is the degenerative cascade. If you look at the very top disc space, which is right here, if you notice it's nice and plump and it's very high, this is a healthy disc. As the disc starts to go through a wear and tear process, you can kind of see that the disc space slightly collapses here, and you can see some changes which look like some kind of reddish changes in there. That's an inflammatory process that's occurring. Over time, if you notice, you keep coming down, you still see that the disc space gets smaller and smaller, but you start to see the formation of these little, what we would call bone spurs or osteophytes. These osteophytes are little edges of the bone that are reacting to the change in the disc space. If you look down here, you notice that the disc space is almost completely collapsed here, and the osteophytes on the side here are almost touching each other. These can be sites of bone pain. If you look here, you can see that there's nice space here for the nerve to come out, but if you look at this the one next to the bottom, you can see that it's pinched, and there's not very much room for the nerve to come out. This can cause back pain and leg pain Generally, when you have back pain, you don't need to go to the operating room. 90% of people that have back pain don't need a surgery. Generally, what you do if the pain is very severe or is long-lasting, you show up to a physician's office. What we do at that time is do a history and physical to try and determine what's the cause of your back pain. And we want you to get back to your life, your work, enjoying your family, your hobbies, and your friends. That's the goal of life, and that's where we want you to be when we're done.
Caffeine is a drug, but it's a legal drug, and it has great side effects, and we love what it does to us. There are certain downsides to it. Now remember, caffeine is even found in small amounts in decaffeinated coffee and decaffeinated beverages, but not in high amounts. Now when you drink caffeine, good things happen, like alertness goes up, you feel better, you think quicker. There's even been studies that show you're more sociable and more friendly and more likable. Isn't that a cool thing to have from a legal over-the-counter drug? There are certain downsides to caffeine, though. For example, it can raise your blood pressure a little bit and your pulse rate. That's usually not a big problem. There are instances where it can raise the risk of bladder cancer, but that's in people who drink high doses, like 6 or 8 doses of caffeine a day. Now also, if you're over 40 or 50 years of age and you drink caffeine in the afternoon or evening or prior to exercise, you probably should wait 3 hours before you exercise, because caffeine can raise your heart rate, and when you get all that adrenaline from exercise, you can get extra beats, and that can cause the rhythm of your heart to be a problem. Don't be too afraid of it. Just don't exercise heavily if you're older and you drink caffeine within 3 hours.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute tab. We are excited to welcome to the Best Docs program prosthodontist, that is Dr. Dave McFadden. He is the architect behind the world's greatest smiles, also known as the go-to dentist in Dallas. Go-to dentist, how did you get that name? Is it because of the practice, the outstanding procedures you do, the techniques? What is it, Dr. McFadden?
Well, it's a little bit of all of those things, but I think mainly it's the credentials. I've taken the time and the energy to do all the things that are possible in my specialty and become board certified in a couple different things. So I think it's the credentials more than anything.
You know, something I thought that was interesting when I was reading up on this is a lot of people think, hey, if I'm going to get a new smile, what I'm going to see is a cosmetic dentist. Not so.
A lot of people make that mistake because they've been misinformed. Cosmetic dentistry is not a specialty. It's just a word. General dentists use the word cosmetic dentistry to try to attract patients that should end up in a prosthodontist office.
Now, dentist dignity. When you hear that, what comes to your mind?
Well, we've adopted that phrase in our practice, trying to treat people with dignity. A lot of the other practices in town are high volume practices where they're trying to get the most people in the door that they can. And many times those patients don't even get to see the doctor before their treatment. So our approach is completely opposite of that. We bring our patients in, we educate them, they meet with a doctor from the very beginning, all the way through the consultation. It's in a private consultation room with the doctor, and we're answering questions as we go through the treatment planning process. So we consider that a dignified approach to dental treatment.
If I'm out there and I'm looking for a new smile and I want to, have a nice gleaming white smile, and I'd say, okay, I'm going to go see the best, and the best is Dr. David McFadden. Will I be out a fortune?
Prices for dental treatment are expensive. No matter where you are in the country, they're expensive. But competition keeps everybody's fees pretty well in line. There's so many people trying to provide the same services that we all have to be about in the same range of treatment. And so no one should exclude themselves from one practice or another because of cost, but it is expensive treatment.
All right, I tell you what, this is the guy to go see, America's dentist, Dr. David McFadden. Appreciate it. Good to have you part of the Best Docs Network.
All of the doctors here at the Best Docs Network are dedicated to changing people's lives. Like our next Best Doctor, it's pain management specialist, Dr. A.L. Shaw.
I came to see Dr. Shaw. I'd had 2 surgeries already, both failed. The first was a laminectomy after injury at work, and the second was a fusion. And after the second operation, the surgeon had pretty much done his part and felt like I should be pain-free. So our discussion was, I don't feel very well, I'm still hurting, and he said, you shouldn't be, I've done the surgery. So that's sort of how we left it. So then I went looking for a pain specialist.
Many of our patients referred by primary care doctors or internists have back pain. Some have not had back operations. Some have had 1 or more back operations. And we spend a substantial amount of our time caring for people that have had previous spinal surgery and are the same or worse after their spinal surgery.
The first consultation with Dr. Shaw, we talked about what are the choices other than surgery. So rehabilitation was one, injections were one to the area that was been affected, and then a host of medications. And so we really set off on a multi-tiered approach to deal with all of those things.
With Mike, he was in such discomfort that he could not perform his job well. Had he given me extra time prior to his 3rd spinal operation, I believe that he would have been better off quite more rapidly than we've been able to achieve after his 3rd spinal operation.
One of the things that I really like about working with Dr. Shaw is that we're able to set up some type of goal when I came to see him in the practice initially. I want to be free from the pain, free from the medication. And so pain freedom is a big deal to me, and it's a big deal to Dr. Shaw.
If one sticks with the conservative model first and then goes to the more invasive model, you don't burn any bridges to trying to feel the best you can be as soon as you can get there. Sometimes when we reverse those actions, it slows down or intensifies your recovery. And perhaps, in Michael's case, you don't achieve all of the goals that you could have achieved had you not had the procedure, that is, the operation.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
My daughter Autry was having really bad eczema, covered from down her knees to her feet, all over her back. You know, it was completely covering her body, 40%. And she had been in the hospital twice, multiple doctor's visits, steroid creams, anything you could think of to get this to go away. It was not working.
Atopic dermatitis or eczema is one of the most common conditions or disorders of the skin that we see in children. It usually presents itself as intense itching in areas of skin that are red and inflamed. This condition is usually chronic, can last as short as a few months, but can last several years and can have a big impact on the quality of life for kids.
Dr. Ghali approached us and asked us to do the study with the CLN body wash, and she immediately changed. We saw a difference in 2 weeks, and then by the end of the 12-week study, she was down to 1% and has had very few outbreaks since then.
Autry presented to our clinic last year, and she was a patient who had recurrent atopic dermatitis. It was a limited body surface area, but what it goes to show you is that in atopic patients, it doesn't take a lot of body surface area to cause problems. And so for this particular child, it was her feet. She began the study last year, and within a few weeks, using clean body wash, we saw a big improvement in her.
Before we got the CLN body wash, she was sick all the time. Since getting this eczema under control, she hasn't been sick. We've had one doctor's visit, and it was her well visit. She's healthy and happy and running around.
not only did we see the improvement clinically, that was something that you could see at home. The mom noticed that the child would sleep better, would make it through the night, would be more focused and more playful. And that speaks very highly of the product and the response that we saw early on and sustained over a period of several months in the study.
The CLM body wash in our house is, lovingly referred to as the liquid gold. We love CLM body wash.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas-Fort Worth area that are changing people's lives.
The good news is, for more information on any of these outstanding doctors, you can find out all you want to know. Head to the website, bestdocsnetwork.com.
That is the place to go. And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We'll see you next week.